Hello everyone. Today we'll be discussing carbon monoxide poisoning. Um, you might want to ask why am I discussing this topic? Of course, if you are working in anywhere that emits carbon monoxide or carbon dioxide, this topic is very important to you. If you are working in any place or any dense populated area where generators are being used or high machines are being used that emit carbon monoxide, this is an important topic that you should listen to. Carbon monoxide poisoning is a condition where one is exposed to, excessive carbon monoxide in the blood, and which results in different manifestation in the body system. Now, we should all know that our body system our blood system has, a very little amount of carbon monoxide in it. Very little, like 0.2 or thereabout. So it's very important that this carbon monoxide level is maintained, and if possible, as much as possible, this very little carbon monoxide, we don't even want to have it in our blood system. It's not good for us to have this carbon monoxide in our blood system, but we can't do without having some very little stain of this carbon monoxide because of the environment we expose ourselves to. The air we breathe is not very pure, and so many other factors, that we can't mention all. So that's why we are even saying, okay, let's say averagely we have a very little percentage of carbon monoxide in the blood system. We must try as much as possible to, take care of ourselves so we don't develop any symptom that is resulting from a carbon monoxide poisoning. So carbon monoxide poisoning can occur in anywhere where there is, exposure to, this carbon monoxide, maybe in factory areas, production centers, and different kind of, facilities or homes where there is regular emission of carbon monoxide. So we need to understand that this carbon monoxide is very poisonous and can affect our nerves and, our different parts of the body. Now, let us look at the first aid management, which is the main reason why we are here. The first aid management of carbon monoxide poisoning. First thing in every, emergency situation is to ensure safety, your safety and the safety of the victim you are about to rescue. You have to remove the victim from, the area of exposure to a safer area where there is no much exposure. Whereas, but you have to, avoid, excessive, crowd, because you are trying to give this person fresh air that he has been deprived of from, a very well exposed carbon monoxide environment. So there should be no much covering. You have to remove the tight clothing to ensure that this person is able to breathe in and out. The essential management of carbon monoxide poisoning is to ensure that the respiratory condition of this patient is no longer, compromised, by ensuring a continuous administration of, oxygen. In some hospitals, this patient is placed on hyperbaric, oxygen, therapy, and this is a very, effective therapy to ensure that the amount or the pressure of the oxygen given, is maintained to almost the one needed or even more than the any poison that is going into the body. So this would ensure that this patient maintains a balanced oxygen and carbon dioxide or monoxide level. So, but in the first aid management, you have to give what, you need to administer what you have at that moment. So, one of the things you need to do is to ensure that, you remove the patient to a safer place. One, you ensure that there are no further gathering around that side. Two, you ensure that there is no further exposure to carbon monoxide to the new environment you are taking the patient to. That's three. You ensure that you remove the tight clothing, you remove anything that will compromise fresh air into the system. You also need to ensure that you place this patient in a comfortable position that will encourage normal breathing. And if this patient is bringing out any kind of substances from the mouth, you ensure that this position, most especially the left side or the right side, ensures that any kind of sputum or whatsoever comes out easily without this patient getting choked. So the next thing you need to ensure that is to ensure that help comes around, where we try to, as much as possible, take this patient to the hospital. And the first thing that they will do in the hospital, like I've said, is to administer oxygen. And while you are administering this care, changing position and doing other things, you also want to check for pulse, you want to check for respiration. And if you remember in our previous lecture, we discussed about CPR. So you will need to make sure that you administer CPR when necessary. You need to check for pulse, you need to check for respiration. And if you can't find both pulse and respiration, you administer a complete cycle of CPR, cardiopulmonary resuscitation. And you ensure that you call the medical team, you call the emergency line 911 in Nigeria, or as your state's demand. Ensure that the immediate emergency line is quickly assessed, and this patient is transported as soon as possible to the hospital. As a first aider, you are just you can do a lot even without any equipment. And everything that I've said now are some of these things that you can do to ensure that you save a life. You must not have to be a medical doctor to save life. When you do these little things, you ensure that you know you have saved a life, and this patient will thank you. Thank you so much for listening. Please subscribe and share this video. You don't know how many people you can save with these very little tips. Bye.